When most people think about stomach problems, they imagine something small and temporary, like indigestion after a heavy meal. But sometimes discomfort in the chest or upper abdomen can come from something many people don't even realize they have. It is called a hiatal hernia, and it happens when a small part of your stomach pushes upward through your diaphragm and slips into the chest area. It sounds alarming, but this condition is actually far more common than most people expect. Many people live with it for years without knowing. Some feel mild symptoms, while others experience discomfort that can interfere with daily life. Understanding the signs makes it easier to recognize when something doesn't feel right and when it might be time to talk with a doctor. A hiatal hernia can create several changes in the way your stomach and esophagus work together. One of the most common feelings people describe is a burning sensation behind the breastbone. This is what we call heartburn. It feels like heat rising from the upper stomach toward the throat. Sometimes it feels like pressure, sometimes like fire spreading upward. It usually happens after eating, especially if the meal is large, spicy, or high in fat. When you lie down or bend over, the burning can intensify because gravity no longer helps keep acid where it belongs. Many people notice that their nights are particularly uncomfortable. Lying flat can allow acid to move up more easily, creating a sensation strong enough that some mistake it for something more serious, like heart trouble. The difference is that heartburn usually improves with antacids and rarely spreads to areas like the arms or jaw. Another sensation many people with a hiatal hernia deal with is the sour or bitter taste that suddenly appears in the mouth. This happens when acid moves upward from the stomach into the esophagus. It can happen during meals, shortly after eating, or even in the middle of the night. Some people wake up with that unpleasant taste lingering in their throat. It is not just uncomfortable. Over time, this backflow of acid can irritate the esophagus and create more serious issues if ignored. Certain movements, such as bending over to tie shoes or lifting something heavy, can suddenly push acid upward. Everyday activities that never used to cause problems may suddenly trigger discomfort. Some people experience something even more surprising, small amounts of food or liquid coming back up into the mouth without any warning. This is regurgitation, and it happens effortlessly, unlike vomiting. It can be embarrassing and uncomfortable, especially if it happens during conversations or daily tasks. The taste is usually sour because of the presence of stomach acid. When regurgitation becomes frequent, it can even affect dental health, wearing down the protective enamel on the teeth from repeated acid exposure. A hiatal hernia can also interfere with the way food moves through the esophagus. Some people start to feel like food is getting stuck partway down, creating a tight or uncomfortable pressure in the chest or throat. This sensation can last for a few seconds, or linger until a sip of water helps push the food down. At first, it may only happen with dense or dry foods like bread or meat. Over time, the difficulty may appear with softer foods or even liquids. This can cause anxiety around eating, making meals stressful instead of enjoyable. People may start avoiding certain foods or eating in public out of fear that they might choke or struggle to swallow. Pain is another symptom that can appear with a hiatal hernia. It can feel like burning, sharp pressure, or a heavy weight behind the breastbone. Because the nerves in the chest are closely connected, the pain can mimic heart-related discomfort. That's why it is always important to get chest pain checked by a healthcare professional. Pain may also appear just below the rib cage, in the upper part of the abdomen. This happens when the stomach shifts into the chest cavity and becomes squeezed or irritated. The pain tends to worsen after meals or activities that increase abdominal pressure, like bending or lifting. Sitting upright or taking an antacid often brings relief. Some people notice that they feel full much sooner than usual. Even after just a few bites, the stomach sends signals of fullness or discomfort. This happens because the portion of the stomach that has moved into the chest cannot expand the way it normally would. Food may sit longer in the stomach, slowing digestion and causing the uncomfortable sensation of being overly full too quickly. Over time, this can lead to unintended weight loss if people avoid eating large meals or reduce their calorie intake without realizing it. Bloating and frequent belching are also common. Because the stomach shifts out of its normal position, gas becomes trapped more easily. The belly may feel tight or swollen, creating pressure that is difficult to relieve. Even continuous belching may not bring complete comfort. Foods and drinks that usually cause mild gas, such as carbonated beverages or high-fiber meals, can cause more intense bloating for people with a hiatal hernia. When stomach acid travels higher into the throat, it can reach delicate areas such as the vocal cords. This leads to hoarseness, throat irritation, and sometimes a persistent dry cough. Some people wake up in the morning with a raspy or weak voice because acid may have reached the throat during the night. Throat clearing becomes frequent, and some feel like something is stuck in their throat. These symptoms can be easily mistaken for allergies or a cold, but silent reflux from a hiatal hernia can be the true cause. Breathing can also become more challenging when the stomach pushes into the chest. Large hernias may press against the lungs, reducing the space they need to expand fully. This leads to shortness of breath, especially when lying down after a meal or engaging in physical activity. The sensation can feel as if breathing requires extra effort, even though oxygen levels are normal. This can create anxiety, which may worsen the breathing difficulty. Elevating the upper body during sleep often helps reduce this discomfort. A more serious complication arises when bleeding occurs inside the upper digestive tract. This can show up as vomiting blood, which may appear bright red or resemble dark coffee grounds. It can also appear as black, tarry stools. This type of bleeding happens when chronic acid irritation causes ulcers or erosion inside the esophagus or stomach. It is a sign that the tissue has been damaged, and it requires immediate medical care. If blood loss continues over time, it may lead to anemia, causing fatigue, weakness, or dizziness. Understanding these symptoms helps you recognize the signals your body sends. A hiatal hernia is common and often manageable with simple lifestyle adjustments, medication, and guidance from a healthcare professional. Listening to your symptoms early can prevent complications, protect your digestive health, and help you live more comfortably and confidently every day.